Okay, as we continue with the nursing process, we are now in the implementation stage, which is considered the fourth step in the nursing process. So after nursing diagnoses have been identified, we will initiate interventions, and the goal is to achieve whatever we want our patient to do by the end of our shift or long-term wise, and expected outcomes that support or improve the patient's health status. Nursing interventions can be either direct or indirect, and usually nursing interventions should be evidence-based and should be used with the most up-to-date approaches to solving patient problems. So what is a nursing intervention? The definition is that it's a treatment based on clinical judgment, which requires critical thinking and knowledge that our nurse performs to enhance patient outcomes. So this is where we come in and we decide, what are we going to do to help this patient achieve this goal that I have just developed. Interventions include direct or indirect care measures aimed at either the patient themselves, families, or the community. So, and interventions, like we said, if you're basing it on a community, you're going to do things that are going to be based on your goal. So let's say your goal is that you're going to educate a group of preschoolers on hand washing, and this preschooler is going to identify 3 to 4 things by the end of your presentation on why it is important for hand hygiene. So you're going to go ahead and do these interventions that are going to achieve this. So whether it be to use examples or use repetition, whatever you plan to do will go into your interventions. Now, more in acute care setting, if we want our patient to have a goal of improved oxygen saturation of 92% by the end of our shift on whatever date, we're going to have interventions: elevate the head of the bed, cough and deep breathe, perform respiratory treatments, or collaborate with RT to perform respiratory treatments. And as you select each intervention, there has to be some kind of science behind it, okay? Which is why critical thinking is necessary, because there's such a complexity of different types of interventions that we can do for our patient. It's important that we pick the correct one, and choosing the correct one takes critical thinking. And the critical thinking model, there is one described in chapter 15. It shows you a framework on how to make decisions if you need that assistance. And before nurses proceed with the intervention, you need to consider know about the purpose of the interventions, such as what steps are going to be required while performing these interventions correctly, and the medical condition of your patient and the expected response. Standard nursing interventions, we talked a little bit about some NIC interventions, which is the NIC, which is NIC interventions is nursing intervention classification, and then you have NOC, which is a nursing outcome classification. Standard of nursing practice offer guidelines for selecting these interventions. Clinicians within our healthcare organization sometimes choose to review scientific literature on these standards of practice and how these guidelines are developed. A nursing care plan is very unique and individualized to an individual patient, so it should not be generalized. So interventions at the same time need to be individualized as well. However, some patients do have common healthcare problems, and if we go back to the example that I use, let's say raising an oxygen saturation because someone is having some difficulty with their breathing, those interventions that are mentioned can be generalized. So you have some general ones and then you have some very specific ones, because let's say there's no breathing treatments ordered for this specific patient, and that's because if some of you may or may not know that some of the breathing treatments we use, such as albuterol, will raise a heart rate. Now let's say we do have a patient with infection and they currently have a heart rate of 140. Are we going to want to initiate breathing treatments or collaborate with RT to give this albuterol? Perhaps not. Maybe we might want to change it to something else. So see how that kind of plays a role in how we pick what we pick for our patient. And then do know that the ANA standards of professional nursing practice are used as evidence to the standard of the care that we provide as registered nurses to our patients. Here are some protocols and their guidelines. So with guidelines and protocols, they're systemically developed. They're a set of statements that help nurses, physicians, and other healthcare providers make decisions about appropriate healthcare for specific clinical situations. A guideline will guide you with specific problems or conditions such as low back pain, dizziness, DVT. The things that we do in the hospital, we have guidelines for DVT prophylaxis. Then we have standing orders, which is a pre-printed document containing orders that you're going to follow based on conditions that are going on with your patient. A good example of this would be, let's say you have a patient on Lasix, and as nurses that use critical thinking, we know that Lasix is going to decrease our patient's potassium. And let's say that our patient is on high doses of Lasix. We should have a standing order for potassium replacement. So as we get our labs, and our labs will be drawn on a daily basis, let's say we're drawing electrolytes, and if we draw these electrolytes, we're going to see what the levels of the potassium are, and we'll have orders such as replace potassium if the level, and it's very specific, it tells you how much potassium to give depending on the result of your patient. So it'll have, for example, 40 MEQ replacement for a potassium of 3.1 to 3.4, or vice versa. You know, it'll be very specific. And then as far as emergencies, we all have BLS, and some of you should get your ACLS by the time you're done with this program, where we can, that's already a practice that is protected. So if we initiate them, we are protected by the hospital because they're considered standing orders. So the process of implementation is as follows. You remember, things change as your patient's condition changes, so does the process of a care plan. You need to prepare to implement your interventions to provide efficient, safe, and effective nursing care. As you reassess your patient, you're collecting data, you're identifying any new needs. So when new needs are assessed, we're going to have to modify our care plan. Let's say you have a patient that has fallen under your care. So now you have to go back, modify your care plan to make sure you have a goal of your patients, keeping them safe while the end of during their hospital stay. So it doesn't necessarily have to be one that's going to be completed on your shift, but it can be an ongoing goal, and you're going to have interventions that are going to protect your patient, keep the bed light within reach, call light within reach, your bed in low position, socks or slippers that provide a grid, or you may even put a bed alarm, whatever the case may be, but you're going to have to modify this care plan to meet the needs of your patient now. So it's necessary to anticipate that things will happen to our patient. So we need to know, what are we going to anticipate? What do we need to do to prevent complications? Risks to patients come from both illness and treatments. So treatments can be, we gave morphine, so now our patient became hypotensive, or let's say we gave a lot of blood pressure medications and the patient became hypotensive and failed, and we need to have somewhere, either in education or in our plan of care, that we have educated our patient to call us before getting out of bed. That way you are protected in case your patient gets up and falls. So make sure that you're keeping this well organized. You're addressing things such as infection control practices, and you're keeping your patient safe at all times. So as we anticipate and prevent complications, there come in 4 steps. You want to identify, what is your patient at risk for? and you want to adapt interventions to the situation. So going back to our patient of Fell, now we're going to have interventions where we're going to put the bed alarm. We're going to have the call light should have been within reach, but maybe we didn't have the bed alarm on because this was a patient who was independent, coherent. But now that this happened, we need to address it. So we're going to add that. We're going to evaluate the relative benefit of the treatment versus the risk. So we're going to put a rationale on why this new intervention protects our patient. And we're going to initiate risk prevention measures. We're going to do that at all times throughout while this patient is hospitalized with us. And modification of a written care plan. If after you assess your patient, you're going to review the care plan. You're going to compare your assessment, and you're going to have data to validate the nursing diagnosis. Because remember, you always need data to validate that and determine whether the nursing interventions remain to be the most appropriate for your patient's clinical situation. Remember, you want to. This is something very important. You constantly want to make sure that your care plan matches what's going on with your patient. You don't want to have a care plan that's based on, let's say, post-op surgical pain, but your patient currently is still hospitalized, not because they had this surgical procedure and you anticipated pain, but because now they developed pneumonia. Now we're treating an infection. So that needs to be addressed in the plan of care. Here is a question for you. Nurse-initiated interventions are determined by state nurse practice acts, supervised by the entire healthcare team, made in concert with the plan of care initiated by the physician, or developed after interventions for the recent medical diagnoses are evaluated. Nurse-initiated interventions are determined by the state nurse practice acts. Implementation skills. There are 3 skills that are needed to implement direct and indirect nursing interventions. You have cognitive, interpersonal, and psychomotor skills. No intervention should be automatic. You need to think and anticipate how to individualize the care of your patient. Interpersonal skills are developed to make sure your patient is trusting you, so you develop a trusting relationship between yourself and your patient. You're going to express a level of care and communicate clearly with patient and family. And as far as psychomotor skills are in play, it takes time and practice to acquire psychomotor skills, so make sure to take advantage of the time in the nursing skills lab as we check you off to make sure that you are safe to do certain skills that you can also put as part of your implementation. Okay, with direct care versus indirect care. We as nurses, we provide a variety of direct care measures, and all these direct care measures require us to be competent, which therefore makes us safe practitioners. It's important to show a caring approach each time you provide direct care. It helps develop trust with your patient as well. So nurses, we spend a lot of time in indirect and unit management activities. So communication of information about our patients when we're doing change of shift report, all of this is very critical because it falls under communication. Ensuring that direct care activities are planned, coordinated, and performed with the proper resources. So we got to make sure we have the proper resources as we do this indirect care. So as we looked closer into this direct care, treatments performed through interactions with our patients. So it's showing you the examples there, which medication administration skills can also fall into this too. And remember, we also counsel during a time of grief. We do many things as nurses. Indirect care, treatments that are done away from the patient but in behalf of the patient. So safety, infection control, any kind of documentation, and as we have interdisciplinary collaboration, whether it be your dietitian, your physical therapist, your respiratory therapist, things like that. More on direct care is your ADLs, your IADLs, physical care techniques, and living measures. And as mentioned before, to complete nursing procedures, you need to know the procedure. You need to know its frequency, the steps. So let's say we just finished doing wound care. So as we do wound care, we knew that you had to be competent to do the wound care. You knew that there was different steps to the procedure along with different things you needed for the procedure and the expected outcome. So by the time you were finished with this dressing change, you knew that the wound was going to be clean and you were going to have a nice clean dressing for performed on your patient. Activities of daily living are activities usually performed in the course of the day: ambulation, eating, dressing, bathing, and grooming. We perform these activities of direct care as you carry out the nursing interventions you have selected for your patients. So these are things you can include as well. You want to be cognitive mobility, pain, confusion, and fatigue. So you don't want to, let's say you have an elderly 70-year-old with COPD. You don't want to put as one of your interventions that the patient is going to walk 4 times around the nurse's station, because that might not be adequate for that specific patient. So you want to make sure you keep those things in mind. IDL are these include the day-to-day activities that they perform, such as shopping, preparing meals, paying bills, taking medications, things like that. Physical care techniques are activities that are performed by nurses while rendering care. Examples of this is turning, positioning, Foley catheter insertion, NG tube insertion, IV insertion, medications, things like that. Life-saving measures are those activities that we perform, like CPR, anything that we administer during an emergency situation, and fall prevention. And be careful when you delegate things. Make sure that they do fall in the scope of standard of practice for the individual you're delegating the care to. So make sure that obviously administration of medications is not something you can delegate, but you can delegate repositioning or keeping your patient clean and dry. Okay. Here's just more of what we have already talked about: counseling, teaching, controlling adverse reactions, and preventative measures. And here we have a test question. So you are writing a care plan for a newly admitted patient. Which one of these outcome statements is written correctly? So you got to make sure that you pick something that has a date, a time, well, not necessarily a time, but this one here, the answer to this is D. The patient will identify the need to increase dietary intake of fiber by June 5. This one is specific and it has a date, and A is good. It is something that's measurable, but it doesn't have a date. B, the nursing assistant will set the patient up for a bath every day. That one's not good, because it's something that the nursing assistant, you're putting the nursing assistant there. Number D is still a better choice, and the patient will have improved airway clearance, but how are you going to measure that? And then B, same thing, how is that going to be measured? And D would be better too if we would identify maybe 1 to 2. We could make it even more specific. With indirect care, these measures are actions that support the effectiveness of direct care interventions. Many of these measures may be like manager type of things. Communication is very important, as we do direct care activities are planned, coordinated, performed with proper resources. We have interdisciplinary care plans. We want to make sure that all that we're in communication with everybody that's involved in the care. Staff in many institutions develop interdisciplinary care plans because they want all teams to have their goals and their interventions. And many times nurses who develop the plan of care do not deliver the care, because let's say you initiate the care plan and some of the activities are going to be performed by other healthcare team members. These would be things that are being delegated, such as you have, let's go back to our patient with you wanted the oxygen saturation to improve to 90%, but if they're having nebulizers and your facility does not allow you as a nurse to do the nebulizers, but rather than physical therapy, then they would be the ones to perform that intervention. You wouldn't, but you would still include it as part of your interventions because it is a good intervention that's going to help your patient achieve their goal, which takes us to achieving our patient goals. We're going to implement the care that meets the goals for our patient. We're going to have multiple interventions. Most schools will require you to have anywhere from at least 3. Some will require you to even have as many as 5. Priorities help us to anticipate the sequence of nursing interventions. Make sure you adhere to the means that are the needs for the patient and families, because if patient adherence means that patients and families invest time in carrying out required treatments. Let your patient be aware of their plan. What are our goals? What's going to happen if this is achieved? Let them know what this means, and you have a better chance of your patient being cooperative with the things that have to be done for their care. And that concludes this PowerPoint.